That snap at the back of your ankle during sport is often an Achilles tendon rupture, a complete tear. The Achilles is the strongest tendon in the body. It connects your calf muscles to your heel bone. In a rupture, the tendon tears completely, usually a few centimeters above the heel, where blood supply is poor. It happens most often in adults 30 to 50, especially during sudden bursts of sport after periods of being sedentary. Doctors usually diagnose it by examining the ankle and doing the Thompson test, sometimes confirmed with ultrasound. There are two main treatment paths: non-surgical care in a boot or surgery to stitch the torn ends together. In non-surgical care, the foot is held pointed down in a cast or boot, so the torn ends can heal together. In surgery, the surgeon opens or uses small incisions to stitch the torn tendon ends, usually within 2 weeks of injury. Studies show long-term function is similar with both paths. Surgery has slightly lower re-rupture risk, but more wound complications. Recovery follows stages: protection in a boot, early motion, then walking, strengthening, and gradual return to activity. Walking out of the boot usually starts around 8 to 12 weeks. Light jogging often returns around 4 to 6 months. Return to jumping or cutting sports usually takes 6 to 12 months, guided by strength and hop tests. Risks include re-rupture, wound problems, blood clots, and nerve irritation. Following your rehab plan lowers these risks. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.